মোহন শুরু করবে।
A very good evening all and welcome in this virtual platform for 9th lecture, which is organized by the Department of Anthropology in collaboration with IQAC Haldia Government College. I, on behalf of the organizing committee, welcome our today's respected speaker, Dr. Subal Das. He is also our alumni student. And as well as I also welcome all the participants in this virtual platform. And today our respected speaker will speak about the usefulness of anthropometry, and the students of anthropology, they know what is anthropometry and its various uses and application. And about this particular theme, our respected today's speaker will elaborately discuss its various scopes, its application, and associated methods. So, on behalf of the organizing committee, it is our normal duty to generate the welcome address, and the welcome address will given by our respected officer in charge of Haldia Government College, but due to some network issue, he is not able to come in this live telecast, but he is in his phone, and I request Professor Solil Kumar Dotto, please request sir to tell something about his view on this particular lecture series. Sir, please. SKD sir. Our respected officer in charge will deliver his view in telephone. Okay.
SKD sir, please unmute yourself. Please unmute.
SKD sir, please unmute your phone. SKD sir, please.
And I hope all the participants will be enjoying this talk. And this is actually for the particularly for the students of anthropology, not only for our students but also other institutes also. Simultaneously, this topic I hope we will be benefiting, particularly members of the academic body, whole community will be benefited from today's lecture. So I also extend my heartfelt thanks to the organizers as well as all the staff of the Department of Anthropology of our college for organizing such lecture series, and this is the 9th lecture of this series. So I hope again that all the participants who will be enjoying this lecture, I welcome all of them also, and simultaneously this lecture will benefit all the participants, and it throws some light on the basic uses, particularly the usefulness of the anthropology, how anthropology, principles of anthropology and the contents of the anthropology are being used in the present day for the benefit of the societies as well as the benefit of the academic communities. Lastly, I extend my heartfelt thanks to all the convener, co-convener, and all the teaching staff members of the Department of Anthropology. And I extend my thanks to all participants and other dignitaries who are listening this today's lecture. Hope this lecture will benefit us a lot. Thank you to the organization. Now I hand over.
Okay, thank you, sir. Thank you, sir, for your rigorous contact and every possible steps and measures and your support. And without your support, it is not possible to conduct such lecture series. And today is the 9th lecture series. So thank you, sir. On behalf of the Department of Anthropology, we again appreciate your contact and your encouragement. Thank you, sir. Now, I request our head of the department as well as the main thinker of this lecture series, Dr. Bhuban Mohan Das. Please, sir, tell about this lecture series, its genesis, its scopes, and its growth. Dr. Das, sir, please.
Hello, Mohan, I am.
Yes, sir. Yes, sir. You are audible.
Hello?
Yes, sir.
Mohan.
Yes, yes, sir. Continue, sir.
Him to substance. All other participants. Good evening, everybody. Department of College. I, Dr. Bhuban Mohan Das, welcome you all to the 9th lecture of the state level lecture series in anthropology. Yes, it is the 9th lecture, and today is the for the students of anthropology through this virtual dash during this new normal situation. The organizing committee of this lecture series are feeling really because we receive from all spheres of the academic world. Also, 12 platforms been graced eminent and is very important for especially students to have with the Subodh assistant of anthropology and tribal Guru Kasidas University below Chhattisgarh. The is also the alumni of our department. The alumni of department, that's why we member of department feeling the faculty seems as is the discipline. Today, Dr. Das deliver a lecture on the topic basics of phonetics and application. This topic is very important for the students of anthropology, and at the same time, this is important for any individuals who wants to understand the growth and nutritional status of himself or herself. Hope today's discussion should have a beneficial impact of our student as well as our faculty members of the discipline. And today we are hosting around more than 150 participants, including the students, research scholar, and faculty member of the discipline, not only from different colleges and universities of West Bengal, but also other states of India. Thank you all for your encouragement support. Please stay with us in our future program. And with these few words, I would like to hand over this virtual dash to my colleague, Dr. Mohan Chandra Dolai, to continue the session. Dr. Dolai, please take over this dash.
Okay, thank you, Dr. Das, for your nice brief about such lecture series and about our participants. Now, this is our duty to introduce our respected speaker, that is Dr. Subal Das. He is the Assistant Professor, Department of Anthropology and Tribal Studies, Guru Ghasidas Vishwavidyalaya, Chhattisgarh. Now, I request Mr. Pinaki De Maulik to introduce our today's speaker. Maulik sir, please.
Thank you, Mohan. Am I audible?
Yes, sir. Yes, sir.
Okay, thank you. Good evening, everybody. And I am feeling very privileged to introduce such an eminent speaker like Dr. Shubol Das, who is also the alumni member of our college and Oldia Government College. So I'm trying to give just a brief overview of his very vivid and rich CV. Actually, the Dr. Das possessed a very sound CV, and it is more than over 16 or 17 pages. So it is not possible to me to give this vivid data. I am just briefing down. Well, Dr. Shubal Das is the alumni member of Holdia Government College. He is an assistant professor of the Department of Anthropology and Tribal Development, Guru Ghasidas Vishwavidyalaya, a central university, Bilashpur, Chhattisgarh, India. Dr. Das is the former Assistant Director, IC UGC Human Resource Development Center, Guru Ghasidas Vishwavidyalaya. Dr. Das has completed his graduation in BA Honours in Anthropology from Holdia Government College and secured first class in the examination. He has completed his master degree from Vidyasagar University and with the specialization in biological anthropology and secured first class with silver medal in university ranking. Dr. Das has qualified UGC National Eligibility Test lectureship on December 2007 and June 2008. He had secured an honors in diploma in web-centric computing from NIIT Holdia in 2002. Dr. Das has been awarded by many scholarship like research assistant from 2007 to 2009 under the supervision of Dr. Kaushik Bose, Department of Anthropology, Vidyasagar University, in an ICMR funded major research project entitled as National Status of Tribal Children aged 6 to 18 years of Bankura District, East and West Midnapur, and Purulia District of West Bengal. Uh, he has been a project fellow from 2009 to the December month of 2009 under the supervision of Dr. Syed Abdul Hafiz Moinuddin, Department of Sociology, Vidyasagar University, in an UGC funded major research project that is entitled as The Groveling Museum Muslim Problems and Prospects, a sociological study in two districts of West Bengal. He has been awarded as Junior Research Fellowship by University Grant Commission, Government of India, and he has awarded Senior Research Fellowship by the University Grant Commission in the year of 2011, and he continued to 2012. And by this time, Dr. Das has completed his PhD degree. Dr. Das is a life member of Indian National Confederation and Academy of Anthropologists, that is known as INCA to us, since 2011. And Dr. Das worked as a counselor in Suprabha Panchashila Mahila Udyog Samiti, an NGO from September 2006 to March 2007. He is appointed as a guest teacher, that is non-remunable, to the Department of Anthropology, Vidyasagar University, in the session of 2010-11, and he has continued his teaching degree, his teaching career at the very prior phase of his career, that is the important session, that is 2010 and 11. And after that, he has joined as a guest teacher in the Department of Anthropology, Vidyasagar University on 2012 also. Now he has worked as an assistant professor on ad hoc basis in the Department of Anthropology and Tribal Development, Guru Ghasidas Vishwavidyalaya, Bilashpur, from 2012 at the mid to 2013, and then he has gained in tribal he is working on at the Guru Ghasidas Vishwavidyalaya, Bilaspur. Dr. Das is now supervising two PhD scholars, and he has more than 56 publications, among which 27 are international journals, 29 in national journals, one international book chapter, and one national book chapter with a single book in international repute. Dr. Das has completed a project of UGC Startup Grant, and it is known as Prevalence of Undernutrition and Morbidity among the Hilkora tribal pre-scholars of Jashpur. Dr. Das has presented 12 invited lectures and paper presentation in national and international repute. Dr. Das has a very vast career in co-academic and administrative responsibilities and his positions held in the university, and a few of this is he is been an assistant center superintendent at UTT end semester examination 2013 and 14 Guru Kasidas Vishwavidyalaya Bilaspur. He is the assistant center superintendent in the month of December 2014 and April 2015. uh, he is a counting officer, Guru Kasidas Vishwavidyalaya. It is a non-teaching staff counseling, and he is a polling officer, Guru Kasidas Vishwavidyalaya Student Council Election 2014. Apart from these, he is associated with almost 21 administrative bodies of the universities and other venues as well, and he is the member of the panel of the editorial board of reviewers, that is known as Public Health Nutrition, that is Cambridge University Press, UK, Journal of Anthropology, that is Hindway Publishing Corporation, New York, USA, British Journal of Applied Science and Technology, and BMC Nutrition, Indian Journal of Research in Anthropology, and Journal of Life Sciences, that is Kamalraj Publishers, New Delhi. So, Dr. Das, in his just the age, just the dawn of his age at just 40 years, he is not to senior most scholar of anthropology, but he is going a great academic degrees and opportunities, and we hope that his lecture will be too much important to us. Our students also will be benefited from his lecture, and this is our desired one, and we hope that I do not so I am handing over to Chandra Dulai, who is the convener of the ninth lecture of our college. So, Dr. Dulai, please carry on.
मोहन अनम्यूट करो। मोहन अनम्यूट करो। स्टार्ट থেকে।
Thank you, Mr. Maulik sir, for your nice deliberation and the brief presentation of the biodata of our respected speaker. And you tell right that Dr. Subal Das is the energetic scholar and which published more than 56 publications, including one book. Now, I request our respected speaker, Dr. Subal Das, to deliver her lecture on today's topic. Sir, please, sir. Okay.
Thank you, Dr. Mohan Chandra Dulai. Very good
Yes,
evening
sir.
to you all. It's my honor to be invited as an invited speaker in this state-level lecture series in anthropology. I'm thankful to Officer in Charge Dr. Piyush Kanti Tripathi, Dr. Dipankar Sadhukan, IQAC Coordinator, and Dr. Bhuvan Mohan Das and his team for organizing this lecture series for the UG/PG students of anthropology. Today, I'm going to speak on basics of anthropometry, its uses and applications, which is mainly focused to grow interest among the students of anthropology. Now, I'd like to share the PPT. Mohan sir, please allow me to share my.
Yes, not visible.
Let me share. Let me.
Okay,
Is it
okay,
visible?
okay, okay. I accept it. Now just accept it. Okay, it's okay, sir.
Okay. Okay, let me start with the topic that is basics
Yes,
of
sir.
anthropometry, its uses and application. Myself, Dr. Subal Das, Assistant Professor, Guru Ghasidas Vishwavidyalaya, Central University of Chhattisgarh. Uh, as we all know, anthropometry is very important field area of anthropology where we used to do measurements. And the term anthropometry is derived from anthropos, means man, and the metron means the measurement. If we try to define anthropometry, it's a systematic and scientific measurement of the human body, and it is the measurement of human living body, means the somatometry one, and the humans when we take measurement in human skeletal bones, that is osteometry, including craniometry. And we can say that it is the quantitative measurements of the muscles, bone, and adipose tissues used to assess the composition of the body. The core elements of anthropometry are height, weight, body circumferences, skin folds, etc. Before going into the details of anthropometry, better to know about what are the different types of measurements we use in anthropometry and what are the basics of that. There are basically 5 types of measurement we used to do in anthropometry. The first one is linear measurement. Second is curvilinear one. Third, girth or circumference measurement. Fourth is the skin fold, and the next is pondal measurement. What is linear measurement? And in linear measurement, we synonymously use the term height and length, but are they same or there is some difference? Height, when we take height, means the individual used to stand perpendicular with the ground. And when we take the measurement length, then the individual used to parallel with that of the ground. That is the basic difference between linear measurements of height and length. Now, curvilinear, what is the basic difference between curvilinear measurement and linear measurement? If we take the measurement of head length, head breadth, it is linear, but the landmark that we are using to take measurements are not fixed. We have to search it out. We have to search it out the landmarks so that we can get the exact position from where we have to take the measurement. That's why this is the basic difference between linear measurement and the curvilinear measurement. In linear measurement, the landmarks is fixed. We know the landmark. And in curvilinear measurement, the landmarks is not fixed. We have to search it out for the maximum width or minimum width of the position. Third one is the girth, that is circumference measurement. As we all know, head circumference, mid upper arm circumference, neck circumference, waist circumference, hip circumference. There are so many circumference where we used to take measurements. It is very useful measurement for overall adiposity or central adiposity. Fourth one is the skin fold measurements like BSF, TSF, triple SF, that is biceps skin fold, triceps skin fold, subscapular skin fold, etc. These are the skin fold measurement we used to take in anthropometry. And the last one is the pondal one, but it is very important to take the pondal measurement because it is used to assess the nutrition status of an individual. That is the weight measurement. These are some derived measurements popularly used in nutritional and health status, that is body mass index. It is also very popularly known as Quetelet index, and the unit of body mass index is kg per meter square. And for children, stunting, underweight, and wasting, these 3 indices are used very popularly. It is very popular in use while assessing the nutrition status or health status of children. Next is the waist to hip ratio. It is also very good indicator of central adiposity, waist to height ratio, and PBF, fat mass, and etc. These are some derived measurement we used to take in human beings to assess the nutrition and growth and health status. These are some basic measurements in nutritional assessment. The general measurements are height, weight. The instrument used are anthropometric rod, weighing machine, And the circumferences like mid upper arm circumference, head, chest, minimum waist, maximum height. And the instrument used for these measurements are measuring tape, and which is non-stretchable. And the third one is the skin folds. We use a Halton skin fold caliper, Lange skin fold caliper, Harpenden skin fold caliper. There are so many skin fold calipers. And the measurements are biceps, triceps, subscapular, suprailiac, medial calf. These are few basic measurements used in nutrition assessment. And now, what are the practical implications and reliability in anthropometry? Why we are using anthropometry? If you see, the precision in anthropometry is of utmost importance as it requires a lot of practice. And the most common errors in anthropometry are positioning of the body or bones, reading measurements and recording. Means if you want to take good measurement, proper measurement, right measurements, means we have to position the individual in proper position. And in order to minimize these errors, standard procedures for recording these measurements should be used, which are internationally recognized. And we have to use the standard procedure for taking measurements, which should be error-free. And these are some internationally recognized procedure in anthropometry. As we all know, we took measurements. Why we are different from other subjects? Why we are different from Taylor? This is the very big basic questions we come across when we are in graduation. Okay, what is the basic difference between a tailor and an anthropologist? Why we are different? He used to take measurement. We are also taking measurements. Where is the difference? But there are differences between tailor and an anthropologist. We use landmarks, that is a scientific landmark. And what is the definition of landmark? It's a scientific, conventional or convenient point from or between which measurements have been taken. We used to take measurements between two landmarks. We are using landmarks, but the tailor never used any scientific point. And examples are, there are so many examples. Head length, like G2OP, that is glabella to opistocranium, head breadth, uranium to uranium, EUU. And the second one, the procedure is the FH plane, Frankfurt horizontal plane. Why this plane is very important? Why we are using this in anthropology? It's a widely used plane of orientation of cranium. Initially, at the beginning of this plane, we use this as in cranium, in the measurement of cranium. That is, in craniometry, we use FH plane. Later on, we use it in somatometry also. And this FH plane is based on the placement of skull in porion and orbital, that is P to O, in a same horizontal plane. Means the orbital, the lower surface of the orbit, and the upper portion of the porion is in the same horizontal plane with that of the ground. And in somatometry, it is the placement of eye and ear in the same horizontal plane. Porion and orbital in craniometry, and eye and ear in the same horizontal plane in somatometry. Okay, Frankfurt horizontal plane basically introduced at Anthropological Congress in Frankfurt, Germany in 1884. After 1884, this plane, Frankfurt horizontal plane, started using. We are using after that. This is very important, body planes and orientation. Why it is important? Why this body planes and orientations are very important in anthropometry? Why we have to understand this? What is the use of this? Yeah, there is obvious use of this, because we have to define, whenever we used to define so many landmarks in anthropology, in anthropometry, we are using these terms frequently. And it is not possible every time to remember the bookish definition given by different scholars. It is not possible every time. It is better to use certain techniques so that we can define any landmarks whenever we need it. And to define such landmarks, different landmarks, in a very lucid way, we have to understand these orientations and body planes. See, as the picture shows, there is a lateral, sideward is the lateral one, and the middle position is the middle one, medial one. Ventral means the anterior portion, dorsal is the posterior one. We are using this ventral and dorsal in prehistory also, while drawing the tools, prehistoric tool or lithic tools, ventral position, dorsal position, like that. Similarly, proximal means towards the center of the body. When we are saying proximal, that is towards the center of the body. When we are saying distal, means it is going away from the body. Means we are taking measurements which is far from the center of our body. Transverse plane means the sideward. Cranial means the towards the cranium, as the name signifies. Cranial towards cranium. Caudal towards feet, towards floor. Sagittal at the middle. We are using this term sagittal plane, lateral, anterior, posterior, ventral, dorsal, and proximal, distal. If you know all these terms well, then we can easily define any landmarks, anytime, anywhere. No need to remember the definition given by different scholars. Okay, there, that's why this plane, body planes and orientation are very important. And being a student of anthropology, we should know it. If we know this, we can easily define any landmark anywhere in any examination. No need to means what to say in Bengali, मुखस्त करते होबे ना, and in Hindi it is हमें याद नहीं रखना पड़ेगा, something like that. हमें बहुत रटना नहीं पड़ेगा. Okay, so these planes and these orientations are very important to define different landmarks in anthropology and in other sciences also. And now I would like to I would like to share the definition of physical anthropology and new physical anthropology. What is the basic difference between physical anthropology and new physical anthropology? Because anthropometry is a part of physical anthropology, and we should have some, we all know the definition of physical anthropology, but I just want to share it with you, that what is physical anthropology actually, how to define physical anthropology, what are the different ways to define physical anthropology, and what is the basic difference between physical anthropology and new physical anthropology. Physical anthropology is a branch of anthropology, as we see, that deals with the biological variation, biological evolution, biological growth, and biological development of human being synchronically and diachronically. See the previous definitions given by different researchers, different scholars, different anthropologists. What is the definition? What it says about physical anthropology? Means in physical anthropology, the main areas that we cover in physical anthropology is the biological variation, how we vary, why we vary, what are the parameters on which we vary, biological evolution, how we evolve, what are the basic differences between us and our ancestors, other hominids, biological growth, how we grown up, what are the changes that occurs from birth to death, what is development, means the biological development, what are the changes that occurs in us in course of time, in course of development. And these two terms, that is growth and development, is also very important, and it is sometimes we use it synonymously, but growth and development, it has a different meaning. We have to understand this, that growth is the increase in the number and size of cell and cell organelles. And how it is different from development? Development is the biological development is the functional advancement of the organs and organelles that we have since our birth. We all have all the organs since our birth, but all the organs are not functioning since birth. It took time. There are so many examples, as we all know, that functional advancement occurs after a certain period of time in all individuals, in all organisms. So The physical anthropology deals with the biological variation, biological evolution, biological growth, biological development of human being synchronically and diachronically. Why this term synchronically and diachronically we are using here in this definition? In simple words, synchronically means over time and diachronically means over space. Means these changes, this variation, evolution, growth, and development, what are the changes occur over time? And diachronically means how we vary. We belong to a species that is called Homo sapiens sapiens, modern intelligent man. And there are so many different races, as we all know. We vary with respect to so many morphological, anatomical, genetical character. And this variation is there. And we used to study the variation, how we evolve, how we vary, why we vary, what are the growth, how it occurs. We used to compare individuals in same space. That's why we are using synchronically means over time and diachronically means over space. Now, how this physical anthropology is different from new physical anthropology, and who gave this term new physical anthropology, or we call it as a biological anthropology. Earlier we used to call it physical anthropology. Now these days we are using the term biological anthropology instead of physical anthropology. Now, what is the difference between physical anthropology and new physical anthropology? If you see that new physical anthropology, according to S. Washburn, this question has come in NET when I was there as a student. When I was a student, who gave the term new physical anthropology or biological anthropology? It was Washburn in 1951. And what he says about new physical anthropology, how it is different. According to him, we need new ideas, new methods, new workers, and we must collaborate with social scientists, geneticists, anatomists, and paleoanthropologists to understand the structure and evolution of man. Now see, what are the changes occurred from physical anthropology to new physical anthropology. There we used to do biological variation, evolution, growth, development. Okay, according to time and space. Now, we are collaborating in new physical anthropology. We used to collaborate with other social scientists also, other geneticists also, anatomists and paleontologists also, to understand the structure and evolution of man, how we evolved, why we are like this, why our structure is like this, what are the changes that occurs due to social or cultural changes. We used to correlate with all these subject, and genetics is one of the important part where we used to study the human genetics, that is molecular genetics, and chromosome analysis is very important part of this new physical anthropology. The definition of new physical anthropology is incomplete if you are not saying that there's a contribution of molecular genetics and your chromosome analysis. It's a very important part of this. Now, why is anthropometry important in growth monitoring? What is its importance in growth monitoring? Why we are using the anthropometric technique in growth monitoring? Because anthropometry plays a vital role in oxology. That is, oxology is the growth study. It's the scientific name of growth study. Anthropometry plays a vital role in oxology. With the help of anthropometry, we can identify the individual, mainly the infants, children, and adolescents, for their growth faltering. When we are saying that growth monitoring, growth, as we define, the growth is the increase in number and size of cell and cell organelles. Means if you want to see the changes, if you want to monitor the growth of an individual, means our subjects should be infant, children, and adolescent, where we can see the changes, where we can see the growth, linear growth actually. Ponderal growth we can see anytime, circumference growth or skin fold growth we can see it anytime. But if you want to see the linear growth of an individual, then we have to take subject like infants, children, and adolescent, because they are in the growing age. And if there is a growth faltering, then it's a big question for us. And there are so many examples like stunting and like that. Second is nutritional assessment. Why this is important in nutritional assessment? Because anthropometry is used by health providers to identify individuals who are malnourished and refer them for proper care and treatment. And at the population level, anthropometric data measured on multiple individuals selected based on the representative samples can be aggregated to provide an estimate of the nutritional status of a population, which can help inform program and policymakers. If we collect data from population and we analyze, and after analysis, if we find that more than certain percent, if the more than 30% of the population of certain group is suffering from malnutrition, then we can provide this information to the researchers, to the state authorities, to the health workers, and like that, policymakers, programmers, so that they can make some programs which may be of some use to them to reduce the prevalence of malnutrition, to reduce the prevalence of malnutrition among populations. Now, how are anthropometric data used? How we are using these data? Anthropometric data provide information on nutrition status of individual as well as population, as we all know, and this information helps to determine nutrition trends. We know the trends. Where there is a nutrition problem, what to do about that problem, and whether the action taken are working. There are so many nutrition programs run by our government as well as governments of different countries. And it is one of the very focused area, as we all know, NCHS, NFHS, National Nutrition Program, NNP. There are so many programs, and they focus to reduce the prevalence of malnutrition. They reduce to focus the deficiency disorders. And this anthropometric data plays a vital role to identify the individual as well as population who are suffering from that. And we can plan and we can check whether the actions are working or not. The programs run by the government to reduce the prevalence is working or not. We can check with the help of this data also. Now, how are anthropometric data used for individuals? As part of nutrition assessment and screening, anthropometry is the commonly used to assess the growth pattern, okay, well known, and the nutritional status of individual to identify at risk of malnourished people so they can be referred to appropriate care. After knowing the status of individual, health status or nutrition status of individual, we can refer them to appropriate care or to tailor nutritional counseling. We can counsel them, or counselor can counsel them after knowing his status or her status. And treatment to an individual's nutrition status, we can provide treatment also after that, and to monitor the response of malnourished individual to intervention. If some intervention is going on, what is its response? So we used to take control group and a treatment group. Whether the treatment is working or not, we can see with the help of this. We can take the anthropometric data and we can find it out. And anthropometry remains a key method of determining eligibility for certain care. This is one of the key methods for certain cares and support programs, and is critical in determining what services are needed. And it helps us to find out what kind of help, what kind of services are needed in population, in individuals. Now, how this anthropometric data are useful in population? And this is the regular and systematic collection. If you are talking about the population, this is the regular and systematic collection, analysis, and interpretation of data to track the nutrition trend of a population in a timely manner. And anthropometric data from nutrition surveillance help to inform policy decisions, target and design programs and intervention, and identify and raise awareness about deteriorating nutrition situation before they reach crisis level. Means with the help of this anthropometry, we can identify the population who are in need. We can intervene, we can take some decision, we can we can frame the programs, we can develop some policies, how to reduce them before it reaches its critical level or crisis level. Now, this is a very important chart, as we all know. Many of you know about this. This is the classifications given by WHO to find out an individual or population having BMI which is less than, more than, or normal. And it is very important. It is very important. Health is now of prime interest to all. Health is wealth, as we all know. And it is very easy. With the help of BMI, body mass index, we can easily identify ourselves whether we are fit, whether we are normal or not, with respect to our nutrition status, whether we are taking nutrition properly, whether we are taking diet properly or not. And this classification is used for adults, that is 18 years of age and older, means 18 years and above. And this is the classification given by WHO expert. As it signifies, if the BMI value is less than 18.5, he or she is designated as underweight, undernourished. And this is applicable for both male and female. And if under this underweight,
sorry, Dr. Das sir. Hello.
Hello.
Hello, Dr. Das sir. Sorry for interrupting you, sir. Sir, please maximize your presentation, sir.
Okay.
For the larger view, sir. Please, sir.
Sure. Is it okay now?
Yes, sir. Yes, sir.
Okay. Now see what it says, what this classification of BMI says about the nutrition status or health status of an individual or population. If a person belonging to the BMI which is below 18.5, we designate them, we classify them as underweight individual. And it has three categories, subcategories. If the value is less than 16 kg per meter square, he or she belongs to severe thinness, or we can say CED3, chronic energy deficiency, third category, third grade. If the value is in between 16 to 16.99, he or she belongs to moderate thinness, or we can say CED2, chronic energy deficiency, second group. If the value is between 17 to 18.49, he or she belongs to mild thinness, matlab CED1. Means if we want to be a normal person with respect to our nutrition, means our BMI should be placed between 18.5 to 24.9. See the classification. Normal range is from 18.5 to 24.99. And if the value of BMI exceeds greater than equal to 25 kg per meter square, then we belong to overweight. Now, if the value further exceeds to greater than equal to 30 kg per meter square, we belong to obese, which is very bad situation for us. We have to control. And there are further subdivisions, subclassification of this obese. Obese 1, when the value BMI value is between 30 to 34.9. Obese 2, 35 to 39.9. And obese 3, that is extreme condition, that is greater than equal to 40 kg per meter square. This is all about the table classification of BMI. Now the second table shows the woman's height. What should be the minimum height of women? It should be greater than equal to 145 centimeter. If an adult woman has a height of less than 145 centimeter, the condition is short stature, and it has so many other conditions that arises due to short stature. This is the very important classification given by WHO for child growth standard. And here we are using the formula that is Z score. Z score is very important to classify or to identify the individual, particularly the infants and the children, for their health and nutrition status. And this classification, this table shows the classification of Z score. And what is Z score then? How to define it? Z score is the location of raw score in terms of its standard deviation of the reference population. If we try to define Z score, then we can define it as a Z score is the location of raw score of an individual with reference to his or her median reference value and its standard deviation, means standard deviation of the reference population where he or she belongs. And the formula of Z score, as we all know, is the x minus mu by sigma. That is, x is the individual value for whom we want to find out where he is or she is with respect to his nutrition status. Mu is the median value of the reference population where he or she belongs. And the sigma is the standard deviation of the reference population where he or she belongs. And this is the formula of Z score. And this classification, this classification shows the growth standard of children. As we see the anthropometric indicators on the left side, on the first column, then there is a age 0 to 23 months, 24 to 60 months, and remaining 7 columns are Z score values. If the Z score values is this, where we belong. The first one is the length for age. See, there is a difference. Length for age, the age group is 0 to 23 months, means before 2 years of age, because many of the infants and children are not able to stand properly by this age, many, due to so many reasons. That's why it is length for age. It designates height for age. See the age group, that is 24 to 60, when a child is able to stand properly in his own feet. And see the classification of Z score. If the value is in between -2 to +3, he or she belongs to the normal category. If the value is -2 to -3, moderate stunting. If the value is below -3, then severe stunting, monitoring required, intervention required. And what about the plus value? That is, if the value exceeds +3 of Z score, then extreme tallness, which is not the issue of your nutrition, maybe due to the endocrine or maybe the genetic, hereditary chromosomal aberration, maybe. Now the weight for age, that shows the underweight of an individual. Weight for age, same. If the value is in between -2 to +1, normal. If the value exceeds +1, then do not use weight for age to determine overweight. Okay, better for assessing overweight in children. And if the value is less than -2, then he or she belongs to moderate underweight. And if it is less than -3, it is severe underweight. Now weight for length, that is wasting, or weight for height we used to call it. If the value is less than -2 but within -3, moderate wasting or acute malnutrition. Moderate acute malnutrition we are using now these days, MAM and SAM. It's very popular now these days. And if the value is less than -3, we used to call it as severe wasting or severe acute malnutrition, SAM. Same for this, that is, if the value is between -2 to +1, normal. +2 to +3, possible risk of overweight. +2 to +3, overweight. And if it exceeds +3 Z score, then it is obesity among children. BMI for age, same, -2 to +1 normal, -2 to -3 moderate, wasting, less than -3 severe wasting or SAM. Similarly, on the right side, if the value exceeds +2 but within +1 but within +2, it is possible risk of overweight, +2 to +3 overweight, and if it is +3 greater than equal to +3, it is obesity. Now it is the last one is the head circumference for age. Very small head, if the value is less than -3 Z score. Small head circumference when the value is between -2 to -3. If the value is in between -2 to +2, then it is normal. And if the value exceeds +2 Z score, then large headed head circumference, that is macrocephaly, not related to nutritional status. It is also due to, it may be due to endocrine disorder or maybe due to heredity. This is the public health prevalence threshold. What will happen? What is the threshold prevalence if the stunting, wasting, underweight, BMI has this much of percentage? If the prevalence threshold is less than 2.5, then very low for stunting. Similarly for wasting and overweight. If the value is in between 2.5 to 9%, for stunting, it is low threshold. 10 to 19, medium. If the percentage is 20 to 29% of the population suffering from stunting, then it is high threshold. And if the percentage exceeds greater than equal to 30, it is very high. Intervention required. Immediate intervention required. Similarly for wasting, 2.5, 2.5 to 5, 5 to 9, 10 to 14, greater than equal to 15. Then for overweight, that is same, 2.5, 2.5 to 5, 5 to 9, 10 to 14, greater than equal to 15. Similarly for BMI, if the percentage exceeds or if the percentage is in between 5 to 9, low prevalence, 10 to 19, medium, 22 to 39, it is high, and if it is more than equal to 40%, then it is very high. Now, these are some few uses of anthropometry. As we all know, it's a branch of anthropology that involves the quantitative measurements of human body, and it is the single most portable, universally applicable, inexpensive, non-invasive technique for assessing the size, proportion, and composition of the body. With the help of anthropometry, we can assess the size, proportion, and composition of the human body, and appropriate use and interpretation from infancy to old age is a valuable tool for guiding the health and nutrition status. As we all know about population and individual, if we use or if we interpret the data from infancy to old age, then it is very valuable. It's a very important, valuable tool for guiding the health and nutrition status. And pediatricians have long used child growth as an important parameters to evaluate the health and well-being of children. As we all know, the use of anthropometry in the field of forensic science, medicine data back to 1882, when Alphonse Bartillon, a French police expert, invented a system of criminal identification. With the help of anthropometry, they used to identify the criminals based on anthropometric measurements. And also, anthropometry are familiar with the range of biological variability present in the human population and causes, and the well-trained in comparative osteology, human osteology, craniometry, optometry, racial morphology, skeletal anatomy, and functions. It has so many uses. The use of anthropometry is huge, starting from the forensic scientist, pediatrician, anthropologist, and so on. In the beginning, as we all know, the racial classification were made by the researchers, the scientists, the anthropologists. They use anthropometry, craniometry, cephalometry, anthropometry to classify or to see the variation, to find out the races of human being. They classify peoples on the basis of their head, on the basis of their stature, on the basis of their body shape and size. And it is also very important if you study the adaptation. As we all know, we all have the adaptation, that the rules, that is Allen's rules, Bergman's rules. What it shows, the shape and size is very important. Why shape and size is very important? What are the advantages of this kind of shape, or any shape of body in different places to adapt in different environmental situation, as we all know? And this forensic anthropometry is a scientific specialization emerged from the discipline of forensic anthropology, dealing with identification of human remains with the help of metric techniques. Forensic scientists also use the technique of anthropometry. And somatometry is well known to study the human biological variability, including morphological variation, as we all know. And somatometry extensively in the estimation of stature from different body parts. Somatometry has its other use also. With the help of somatometry, we can estimate the stature with the different body segments also. And osteometry successfully used in the estimation of stature, age, sex, and race in forensic and legal sciences, as well as in anthropology. And these measurements play an important role in designing architecture. There are terms: architecture used, furniture, tools, car, clothes. We heard the term different sub branches of physical anthropology. There we come across the kinanthropometry, ergonomics, nutrition anthropology, growth oxology. These are some sub branches of physical anthropology, and where we use the knowledge of anthropometry. Ergonomics, man machine relationship. Without the knowledge of anthropometry, we cannot design the machines that we are using. Kinanthropometry, sports anthropology, where we are using different sports things. We have the knowledge. We should have the knowledge of anthropometry for all these. And we use anthropometry in ergonomics to optimize the fit and function of products, both during design and during evaluation. And this anthropometry continued to be a valuable technique, however, gaining an important role in paleoanthropology. Now it's gaining an importance in paleoanthropology day by day. The study of human origin and evolution through fossil remains. It's very important. Paleoanthropology. With the help of fossil remains, we can identify the individual. We can trace the human origin, evolution. Now, what are the advantages of anthropometry? It is less expensive and need minimal training. We don't need much training to be expert in anthropometry. Readings are reproducible. We can reproduce the data easily. We can infer, we can analyze data. Objective with high specificity and sensitivity. It is very sensitive and specific. We used to get accurate data, accurate information after analyzing those data. That's why it is very high specific and sensitive. Measures many variables of nutrition significance are height, weight, head circumference, skin fold thickness, as I already discussed. And it is also very important in reading the gradual on standard growth chart. If we have the knowledge of anthropometry, we can easily study, we can easily read the different charts, growth charts developed by CDC, ICMR, WHO, IOTF, and like that. If we have the knowledge, then only we can read it, we can interpret it. What are the limitations of anthropometry? There are limitations, obvious. Inter-observer errors in measurements, there are. Inter and intra-observer errors are there, always. Problems with reference standard, that is local versus international. It is a long way. One of the major problem for all. That is which reference value, which reference standard we should use, local or international. Which one is more important? Third is the limited nutritional diagnosis. With the help of this anthropometry, we cannot provide some nutritional diagnosis suggestion. We just provide the actual status of an individual or population with respect to their health and nutrition. This is one of the limitations. and arbitrary statistical cutoff levels for what are considered an abnormal values. It is one of the problems also. These are the references that I use to prepare this PPT and this lecture. Thank you. Thank you very much. This is all about my presentation. Thanks to all.
Okay, thank you, sir, for your nice presentation in a lucid manner. Thank you, dear participants, for your kind patience with us. And now, I would like to hand over the charge for question answer session to our respected madam, Dr. Shoumi De. Shoumi, please take over the session, and that is the question answer session. And I request all the participants, please raise your hands or raise your question or any observation or any comments uh, for the for discussion. Or okay, show me please.
Hmm.
Yes.
Hello. Okay. Thank you, Mohan, and thank you, Shubalda. It was a really very nice presentation, and we have some questions in YouTube chat box. So first of all, our student Arijit Pradhan, he has asked, "Sir, if someone want to take a measurement of a dead body, so which technique can be applicable? Is that anthropometry or osteometry?"
Hello.
Hello.
Dr. Dasher, please unmute your mic.
Hello.
Yes, show me.
Yeah. Shubalda, can you hear me?
No, no, sir, will be muted his mic. Please unmute, sir.
Shubalda, can I repeat my
Sorry.
question or
No, I heard it. The
okay?
answer is if we are taking measurement in body, dead body, and if flesh and skin are present, then how can we take the this osteometry? We can take osteometrical measurement only when a skeletonized body is present. No? Skeleton is present. Means we have to take anthropometry, not osteometry.
Okay, thank you. Next question is from Pompa Jana. Sir, how does physical anthropology fit into anthropology?
Okay, how does physical anthropology fit into anthropology? It is a major branch of anthropology, as we all know. The main four branches. Out of this, physical anthropology is one of the important major branch of anthropology that deals with the study of human beings. Anthropology means human study, human science, and physical, as we all know, we used to study human variation, evolution, growth, development, and it is obvious. It is very much fit in anthropology.
Next question is from Sulekha Jana. She is asking about to explain the technique of anthropometric measurements in newborn.
What kind of measurements you want to take?
It was not clear in his question,
What
in her
measurements you want
question.
to take? What measurements? Weighing measurement or skin folds or circumferences? We used to take measurements among newborn by these. We used to take head circumference, whether the head growth is occurring properly or not. We used to take individual with the help of infantometer. We used to take height of length of an individual, that infant, with the help of infantometer. There are measurements we are taking.
Yeah, but she was just asking about, in broad term, anthropometric measurements in newborn, but she was not clearly mentioned in which type of technique she.
Exactly. What you want to ask? I'm not clear about that. The technique of anthropometric measurements. Next, please. Is it okay? Am I audible to all? Hello.
Yes, sir, you are audible, sir.
Please ask next question. I think it is clear.
Actually, he left from the studio due to network issue. Sir, one
Okay.
particular question to you, that is my personal question.
Hmm.
So
Very good.
here in this platform, there are number of our undergraduate students. So if you tell
Okay.
about something, the scope of anthropometry in the field of kinanthropometry, that is the sports anthropology. So the
Yeah, it
scopes
is.
of,
It is.
okay, sir.
A few days back, one of our student is selected there in SAI, Sports Authority of India. There are different players. As we all know, there are different athletes, different players of different games, and their regular monitoring with respect to their health and their nutrition, their diet is very important. And if we have the knowledge of anthropometry, it is of immense use. We can apply there. Few of students are there in their inside Sports Authority of India. So if you have the knowledge of anthropometry, if you have the knowledge of this nutrition, diet, nutrition status, growth, biological development, then we can apply there in the Sports Authority of India SAI. And there are some in DRDO, in SAI. Our few colleagues and few students are there. They are working there. Means we should have some knowledge of anthropometry and this nutrition growth. Then only we can apply. If you don't have the knowledge, then we cannot apply there. It's a very interesting topic also to measure the sports personality, athletes, and all.
Yes, sir. Again, I ask the possibility of the students of anthropology, or the possibility to recruit of the students of anthropology in the field of kinanthropometry, or in the recruitment of SAI, that is the Sports Authority of India, and the other sports related
There is obvious.
academy. Yes.
There is obvious scope, but we have to develop, we have to enhance our skill in anthropometry, measurements. Then, as I said, growth studies, biological development, and your body composition. These are important parameters. These are important variables that we are using, and they also use these parameters variables. Then their diet, so nutrition, diet, nutrients, and these measurements are very important. If you have the knowledge about these things, then we can easily apply. Few days back, more than 21 posts came out, and many of the students used there. Recently one of my dissertation student, he has just completed his PG under my supervision. He has selected there in AIMS Bhopal, and he is doing training there in NIN, Hyderabad, National Institute of Nutrition. Is very happy to join there. So there are
Okay.
scopes. There are scopes.
Okay, thank you, sir. Thank you, sir. So we continue, please. Okay, again, she left us from the studio. This is the network issue. Today is the network is a
Network is big
very,
issue.
yes. Sir,
I'm also
again,
clear
one
network.
question from
Ah,
Sajan Tiwari. He's asking, what is the meaning of somatometry? Just
as we all
please.
know, the soma means the body, metry means the measurement. Means if you want to means if you try to define somatometry is the systematic and scientific measurement of human living body, including head. Soma means body, and metry means scientific measurement. Means that it is the systematic and scientific measurement of body, human body, including head. By this way, we can define somatometry, and this is the meaning of somatometry. I think it is clear to Sergeant.
Okay, sir. Thank you. Again, Arijit Pradhan, he is asking, sir, briefly explain the function of ergonomy in anthropology. Anthropology.
Yeah, ergonomics is very interesting topic when you discuss about this. Means man-machine relationship. When I used to explain this ergonomics in my class, I used to make different postures to explain this. है ना? Suppose if you're riding bike or if you're driving a car, our position in car, our sitting position in bike is proper, no? It is proper.
Yes.
If we keep the seat of bike here at the back side of the bike, then we have to lean towards the handle, and that is not the right posture to drive, no, to ride.
Yes.
Or if our seat, if the position of the seat, if the position of the steering in our car is somewhat different, what we are using now, if it is different from this, then what would be the situation? What it leads to? It leads to so many problems, anatomical problems, so many morphological problems, and so many accidents also. So if we know the relationship between a man and a machine, then only they used to design on the basis of their stature. If you go in different places, if you travel in bus, you will find in different states. If you talk about Bengal, I used to travel in bus. The height of the bus, the height of the roof of the bus is less heighted there in Purulia and Bakula, if it is private bus. And if you go there in Chandigarh, in your Delhi, you will find the height of the roof of the bus is very heighted. Why it is so? If we don't know, if we don't have the knowledge of man-machine relationship, we cannot develop the distance between the seat, the height of the seat, height of the roof, steering, and so on. So the knowledge of ergonomics is very important in anthropology also, and for the ergonomist to design seat and other things. Next, please.
Okay. Okay, sir. Thank you. There is no more question or the
Thanks a
remarks
lot.
in the comment box, chat box. So participants, if you have any question or query, please tell us in our right in the chat box.
You can
Our
note it
resource
down my
person is
email ID
here
also. You
and
can write
is
write
welcome.
it directly to me also.
Okay, no, sir. Direct communication will not be possible here. Okay.
Not now, not now. If someday, if they want, if they have any queries, they can write mail directly to me.
Okay,
I
sir.
can reply to them.
If you give your mail ID, and I will write. Just writing your mail ID here, sir.
Uh,
Repeat, sir.
it's D Subal VU.
D Subal.
D Subal
D
SUBAL.
for Das. D for
D for
Das.
Das. Yeah.
Yes.
D Subal, VU, V for Vidyasagar University, VU
Okay.
at gmail.com.
Okay, this is very fine. Participants, if you have any question or any query, please ask our respected resource person in future, of course. Okay, and you please take it. Your note is this mail ID for your future purpose. Gmail.com. Okay, sir. Again, one question coming from Anushka Patro. He just asking you, sir, the scope of physical anthropology in the field of forensic anthropology.
Yeah, there are huge scope. If you see in India, you will find there are anthropologists, there are physical anthropologists, they are working in the field of forensic anthropology. And a few famous names are also there. You will find it a few days back, a list came out that is, what to say, the world's top 2% Indian scientists, those who are working in different fields. And the name from Chandigarh, that is Keval Kishan. His specialization is physical anthropology. Now he's working in forensic anthropology. If after completion of graduation you are interested to work in forensic anthropology, then you can apply there. It's very good. I went there. I know him, not personally, but through my supervisors. So he's very good. He's very good. He's doing physical and forensic anthropology as a specialization. He's a specialization is physical anthropology, but he's working damn good there in forensic science. So we can do forensic anthropology while doing physical anthropology. Forensic anthropology is one of the paper in physical anthropology while taking specialization in masters. Okay, so we can do.
Yes, sir. Our respected head of the department asking you to briefly discuss about the osteometry for our students, undergraduate students. If you tell
Okay,
some, osteometry.
okay. Osteometry, as the name signifies the osteometry. Osteo means the bones, and the metry means measurement. The definition is very simple. We have to take like this. Osteo means the bones, metry means the measurement. Means it is the systematic and scientific measurements of bones, including your skull. That is cranium. Okay, so in osteometry, we used to take measurements of so many different types of bones. There are different types of bones in our skeletal system. As we all know, there are 206 bones, countable bones in our human skeleton. And the bones, the different bones in our skeleton are categorized into different types. That is long bone, short bone, flat bone, sesamoid bone, and another one is, I forgot the name. These are five types of bones: long, short, flat, sesamoid, and I forget the last name. These are the different types of bones. And long
Floating
bones
one.
no,
Floating
floating
one,
bones.
sir.
No, it's not floating one. It has some name. The example of floating bone is Wurmian bone, that is present there in between the sutures. Wurmian floating bone. It is present there in the sutures, in between sutures. Wurmian bone bolte hain usse. So pneumatic bone, sorry, pneumatic bone. So these are the different types of bones we have. That is long, short, flat, sesamoid, and pneumatic bone. Long bones, as we all know, it has long shaft, two ends. Short bones, the length and breadth are almost equal. Flat bones, spongy layers, it's flat. Sesamoid bones that act as a joint, like patella is the best example of sesamoid bone. Sesamoid bolte hain kabhi kabhi. There are different pronunciations. Sesamoid bones means patella, it acts as a joint, okay, tendon. And pneumatic bone that act as a floating bone there, which is present there in the in between the sutures, that is Burmian bone, उसको हम लोग simply बोलते हैं floating bones. So these are the different types of bones we have, and we have to take measurements in different types of bones using osteometry. And skull is one of the important part of your skeletal system, and it has so many measurements: breadth, height, with sagittal plane, and like that. There are so many measurements, and we are using different linear, curvilinear, or circumference measurements in skull also. And we are using so many technical terms in craniometry or osteometry, like calvaria, calot, neurocranium, splanchnocrinium. These are some technical terms we are using in osteology, osteometry. So there are, it will take time, it will take some time to explain all these one by one, including all the 206 bones. So this is very brief about osteometry. We used to take measurements in skeletal bones, and there are different types of bones, as I said, and cranium is one of the important bone. That's all, I think.
Okay, sir. Again, one question from my side.
Acha,
The ethical issues. That is the ethical
wow,
issue. That is the very important, sir,
very
uh,
important.
for the living body measurement.
Yeah.
Yes, sir.
Uh, Ethical issues are always there while we are taking measurements, but not in somatometry, not in anthropometry. I don't think we used to take ethical permission while taking uh, anthropometric measurements directly, but when we are doing some biochemical, when we are collecting some biochemical data like blood, hemoglobin, and that needs some sophisticated equipment, instruments, then we used to take ethical permission. But it should have, means we should take ethical permission before taking measurements in human being. So it is there in all universities, bodies, institutions, higher institutions, they have their ethical body. And before starting the your research or study or field work, we used to take permission from that body, and we should take.
Okay. Thank you, uh, sir. Thank you, sir, for your nice clarification on the and your observation on the question arises here. So thank you, sir. Thank you again.
Thank
Now
you.
I request Dr. Solil Kumar Dotto to express the vote of thanks. That is our the duty to deliver the vote of thanks. Sir, one more question. If you allow me, then I can ask the question from the participant.
Okay, sure. If I'm
Okay.
able to answer this.
Yes, sir. One question from the Ram Krishna Durve. That is the sir
Hmm.
application of anthropology in molecular genetics.
Okay, definitely I will tell him. The knowledge of anthropology is obvious there in molecular anthropology, because molecular anthropology now these days it is of immense use since 1951, when the term physical anthropology is converted into biological anthropology, only because of this term, that is molecular genetics. The term molecular genetics and the chromosomal analysis, these two terms are used there in physical anthropology. Then only we use to say this is biological anthropology, not physical anthropology. And in anthropology we have a specialization in molecular genetics. So it has obvious application if you have the knowledge of your chromosomes, your genes, and your genotypes, molecular genetics. Then we can apply it anywhere in the different labs, in research centers, big research centers. Few of our colleagues are working there in Delhi, in Chandigarh. They have their own lab after getting knowledge and become expertise there in molecular genetics. They are doing very good in this field. So if you have the knowledge of anthropology, it has obvious use to apply this in molecular genetics. I think Ram is
Okay.
convinced now.
Yes, sir. Okay.
He is
Okay.
one of my students.
Yeah. Okay. Thank you, Ramkrishna Durbe. So now this is the time for the vote of thanks, and for this, I would like to invite Dr. Solil Kumar Dotto, sir. Please take over, sir.
Thank you, Mohan sir. It's a very good evening, a graceful evening to our most valued speaker, or the teachers, OIC, IQAC committee, and the most valuable and beloved students, last but not the least, gathered over here. It is my privilege to have been asked to propose a vote of thanks on this ninth lecture series. As per the request of our HOD, I'm coming to the Bangla, uh, and before that, I would like to start with Sanskrito, that Annodanam Parandanam Vidyadanam Ataparam. Anneno Khanika Chitti Jab Jabot Jivancha Vidyaya. Providing food to poor and needy person is the best charitable deed, but making people learn by teaching them is the supreme form of charity. Food gives momentary satisfaction, but knowledge will empower them to lead a satisfactory life. The verse of Parashara says, Shah Vidya Ja Vimuktaye, that is knowledge which liberates one from bondage. সুতরাং সরকারি হলদিয়া সরকারি মহাবিদ্যালয়ের নৃতত্ব বিভাগের পরিচালনায় আমরা যে নবম পরম্পরা বা নাইন্থ লেকচার সিরিজ রাজ্যভিত্তিক আন্তর্জালিক বক্তৃতামালার আয়োজন করেছি, তাতে বেসিক্স অফ অ্যানথ্রোপোমেট্রি, ইটস ইউজেস অ্যান্ড অ্যাপ্লিকেশনস বা বাংলায় নৃমিতির ভিত্তি এর ব্যবহার ও উপযোগ বিষয়ে যে বিস্তৃত আলোক সম্পাত করলেন ডক্টর সুবল দাস মহাশয়, যিনি আমাদের কলেজেরই প্রাক্তন এবং কলেজকে উজ্জ্বল করেছেন, তাকে জানাই ধন্যবাদ। তার অফুরন্ত জ্ঞান আমাদের ছাত্রছাত্রী ও অন্যান্য যারা আজকের এই বক্তৃতামালায় অংশগ্রহণ করেছেন তাদেরকে সমৃদ্ধ করেছে। এছাড়াও তাদের বিভিন্ন প্রশ্নের উত্তর সমৃদ্ধ করেছে সবাইকে। সমস্ত রকম প্রশাসনিক কাজকর্মের সুষ্ঠু রূপায়ণে নিবেদিত আমাদের মহাবিদ্যালয়ের অধ্যক্ষ মহাশয় ডক্টর পীযূষ কান্তি মহাশয় তার সমস্ত রকম কর্ম পরিকল্পনার মাঝখানেও আমাদের এই আন্তর্জালিক পরম্পরার যে বক্তৃতামালা তাতে উপস্থিত হতে পেরেছেন, তার জন্য আমরা ওনার কাছে কৃতজ্ঞ। এবং এই করোনাক্রান্ত পৃথিবীতে উনিও একজন চূড়ান্ত যোদ্ধা। এই পরিস্থিতিতেও তার উপস্থিতি আমাদেরকে ধন্য করেছে, সত্যি আমরা কৃতজ্ঞ। আমরা ধন্যবাদ জানাই আমাদের মহাবিদ্যালয়ের অভ্যন্তরীণ গুণমান নিশ্চয়তা বিভাগের বা IQAC বিভাগের সমন্বয় সাধনকারী অধ্যাপক ডক্টর দীপঙ্কর সাধুখা মহাশয় এবং তার সহযোগীদেরকে। তার আন্তরিক ইচ্ছে এবং সহযোগিতা আমাদেরকে অনুপ্রাণিত নিরলস কর্মসাথী ডক্টর ভুবন মোহন দাস, ডক্টর সৌমি দে, ডক্টর মোহনচন্দ্র দোলাই, ডক্টর পিনাকি দে মৌলিক মহাশয়, যাদের সুনিপুণ কর্মসাধনায় আজ এই নবম পরম্পরা প্রভাষণ জ্ঞান বিনিময় নিরবিচ্ছিন্নভাবে সম্পন্ন করা সম্ভব হয়েছে, তাদের জন্য আমরা গর্বিত। আন্তরিক অভিনন্দন, নমস্কার ও ধন্যবাদ জানাই সেই সমস্ত অধ্যাপক অধ্যাপিকা, গবেষক গবেষিকা ও সকল শ্রেণীর শিক্ষাকর্মীদের, শিক্ষার্থীদেরকে যারা আজকের এই আন্তর্জালিক জ্ঞান বিনিময়ে তাদের মহতি সময়ের কিঞ্চিত ব্যয়িত করলেন। আপনাদের একান্ত সহযোগিতা আমরা সমৃদ্ধ হলাম। আপনাদের উপস্থিতি আগামী বক্তৃতা মালাগুলোতেও কাম্য, এই অনুরোধ থাকলো। সমৃদ্ধ হোক নবরূপে আগামী জ্ঞান বিনিময়ের দিনগুলো। যান্ত্রিক আন্তর্জালিক কারিগরি সহায়তায় অধ্যাপক ডক্টর মোহনচন্দ্র দোলাই ও ডক্টর পিনাকি দে মৌলিক মহাশয়ের আন্তরিক ও সুচারু পরিবেশনায় সুষ্ঠুরূপে সম্পন্ন হতে পেরেছে আজকের এই মহতী প্রভাষণ বিদ্যা বিনিময় পর্ব। আমাদের নৃতত্ব বিভাগের সর্বময় কর্তা হিসাবে ডক্টর ভুবন মোহন দাস, তার অতন্দ্র পরিচালনা ও ব্যবস্থাপনা, তার অবদান প্রতি মুহূর্তে আমাদেরকে বিকশিত করছে। প্রতিটি পরম্পরা বক্তৃতা মালা আমরা আপনার উদ্যোগের জন্য জানাই আন্তর্জালিক হৃদয় নিগ্রাণ ও ভালোবাসা ও নমস্কার। আমার এই অনুষ্ঠানে এটুকু আমি বলতে পারি, যন্ত্র যদি লক্ষ জনের মাঝেও পড়ে থাকে, যদি একজন প্রকৃত যন্ত্রিকা না হন তাহলে বাজাতে পারবেন না। আজকে কিন্তু সেই যন্ত্রিকা সুবলবাবু বাজিয়ে দেখালেন যে সুন্দরভাবে ছাত্রছাত্রীদের কাছে কত সুন্দরভাবে আসা যায়। আমরা আপনার কাছে কৃতজ্ঞ। সবশেষে বলি, নহি সুপ্তস্য সিংহস্য প্রবিশন্তি মুখম মৃগা, অথবা শুরু থেকে যদি বলতে পারি, উদমে নৈব সিদ্ধন্তি কার্যানি ন মনোরথে, নহি সুপ্তস্য সিংহস্য প্রবিশন্তি মুখম মৃগা। Without rigorous efforts, nothing can be accomplished. Just like a deer enter a lion's mouth on its own without him going away on. আমি ছাত্রছাত্রীদেরকে বলবো, আমাদের এই কলেজেরই সুবল চন্দ্র দাস, যিনি আজকে এই জায়গায় পৌঁছেছেন, তার পক্ষে সম্ভব হয়েছে কারণ তিনি অসম্ভব পরিশ্রম করতে পেরেছিলেন। আমি সেটাই বলার চেষ্টা করছি, আবারও বলছি, উইদাউট রিগোরাস এফোর্ট নাথিং ক্যান বি অ্যাকমপ্লিশড। জাস্ট লাইক এ ডিয়ার এন্টার এ লায়ন্স মাউথ অন ইটস ওন উইদাউট হিম গোয়িং ফর এ হান্ট। একটা সিংহ যদি শিকার করতে না যায়, তার মুখে কখনো শিকার আসে না। আমাদের ছাত্রছাত্রীদের কাছে আমি অনুরোধ করব যে পরিশ্রম করতে হবে, যা সফল করতে পারে। ধন্যবাদ। লোক সমস্তা সুখীন ভবন্তু। সবাই ভালো থাকবেন। উইশ ইউ অল দ্য বেস্ট। থ্যাংক ইউ এভরিওয়ান। থ্যাংকস।
ধন্যবাদ ডক্টর দত্ত স্যার। শ্রুতি মধুর কি বলবো, ভোট অফ থ্যাঙ্কস বাংলা কি বলে আমি জানি না, জেনারেট করার জন্য
ধন্যবাদ জ্ঞাপন স্যার, ধন্যবাদ।
ওকে 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 ধন্যবাদ জ্ঞাপন করার জন্য। শ্রুতি মধু, সত্যি শ্রুতি মধু। আমি আমাদের আজকে যিনি রিসোর্স পার্সন আছেন ওনাকে একটু অনুরোধ করব, আপনি যদি বাংলায় আমাদের স্টুডেন্টদের জন্য দু চার কথা বলেন, যাতে ওরা ইন্সপিরেশন পায়। আপনাকে ওদের সামনে পেয়েছে, সো ডিরেক্টলি যদি আপনার কাছ থেকে দু চার কথা শোনে, যদি ওরা নিজেদের একটু উন্মিলিত করতে পারে আপনার মতামত, বা একটু দিয়ে এনকারেজ করেন স্যার, প্লিজ স্যার।
খুব ভালো প্রস্তাব স্যার, খুব ভালো প্রস্তাব।
আমি স্টুডেন্টদের এটাই বলতে চাই কি, আমি যখন হলদিয়া গভর্নমেন্ট কলেজে, আমি জাস্ট 5-7 মিনিটের একটা, আমি নিজের স্মল স্টোরি একটা বলছি, নিজেরই স্টোরি বলছি যে আমি কিভাবে এই জায়গায় পৌঁছেছি। আমি যখন হলদিয়া গভর্নমেন্ট কলেজে অ্যাডমিশন দিই, তার আগে আমি পাঁশকুড়া বনমালী কলেজ, তমলুক কলেজ, ওখানেও অ্যাডমিশন নিয়েছিলাম, জিওলজি, তারপরে এক জায়গায় বটনি, কিন্তু জানি না কেন ওখানে পড়ার ইচ্ছে হয়নি। তারপরে হলদিয়া গভর্নমেন্ট কলেজেও আমি অ্যাডমিশন নেওয়ার জন্য গেছিলাম, ওখানে কেমিস্ট্রি নেওয়ার জন্য গেছিলাম। ভাবলাম কেমিস্ট্রিতে পড়বো। আমাকে স্কুলে আমার টিচার্স বলতেন, ইউ আর সিপ অফ অর্গ্যানিক কেমিস্ট্রি। আমার অর্গ্যানিক কেমিস্ট্রি অনেক ভালো লাগতো। আমি ভাবলাম ওখানে অ্যাডমিশন নিয়ে কেমিস্ট্রি পড়বো, কিন্তু আমার ম্যাথস ছিল না, আমি পিসিবি ছিলাম, ফিজিক্স কেমিস্ট্রি অ্যান্ড বায়োলজি। তারপরে আমি অনেক ভালো বাংলা জানতাম না তখন, মানে আমি যেহেতু বর্ন অ্যান্ড ব্রট আপ দেয়ার ইন বোকারো স্টিল সিটি, দুর্গাপুরে জন্মের পর কিছুদিনের পর আমরা বোকারো স্টিল সিটি, যেটা এখন কি ঝাড়খণ্ডে আছে, ওখানে চলে যাই। সেখানে আমার স্কুলিং হয়। তারপরে আমরা আবার হলদিয়াতে চলে আসি। হলদিয়াতে আমার স্কুলিং শেষ হয়। তারপর আমি হলদিয়া গভর্নমেন্টে যখন অ্যাডমিশন নিলাম, যখন কোনো সাবজেক্ট পাইনি, তার আগে আমি এনআইটি হলদিয়াতে আমি 1 বছরের অনার্স ডিপ্লোমা একটা করেছিলাম, কোর্স ইন কম্পিউটার। তখন একটা ওয়েব চলছিল, সবাই বিসিএ করছে, এমসিএ করছে, কম্পিউটারে কিছু করব, চাকরি পাবো, সামথিং লাইক দ্যাট। আমিও ওরকম ফ্লোতে চলে যাচ্ছিলাম, তো আমিও এনআইআইটিতে জয়েন করি। তারপর দেখি কি না 1 বছরের পর জব যেগুলো পাচ্ছিলাম সেগুলো অনেক স্যাটিসফ্যাক্টরি ছিল না, আমি সেলফ স্যাটিসফাই ছিলাম না, কি না এটা কি কেমন। তারপর আমি গ্র্যাজুয়েশনে অ্যাডমিশন নিলাম, কেমিস্ট্রি হলো না, মনে অনেক খারাপ। তারপর আমাদের সবাইকে একটা প্রশ্ন জিজ্ঞেস করা হয় গ্র্যাজুয়েশনে অ্যাডমিশন নেওয়ার পর, আমরাও এখানে করি কি, স্টুডেন্টস তোমরা বলো এক এক করে তোমাদের নাম কি, কোথায় থাকো, আর তোমরা অ্যাডমিশন কেন নিচ্ছ অ্যানথ্রোপলজি। তো আমার আনসারও সেই ছিল কি আমি কোনো সাবজেক্টে অ্যাডমিশন পাইনি, তাই আমি অ্যানথ্রোপলজি নিচ্ছি। ভেরি গুড, ম্যাক্সিমামদের আনসার এটাই ছিল, ম্যাক্সিমাম এখনো এটাই হয়। অ্যানথ্রোপলজিতে অ্যাডমিশন কেন নিয়েছো, কেন কি আমরা কোথাও পাইনি তাই নিয়েছি। ঠিক আছে, তারপর অ্যাডমিশন নিয়েছি। অ্যাডমিশনের পর গ্র্যাজুয়েশন পড়া স্টার্ট পড়ছিলাম। ঠিক আছে, একজন স্যার ছিলেন, আমাদের 2জন টিচার ছিলেন তখন, সুব্রদেব স্যার আর কৌশিক ভট্টাচার্য স্যার। তো একদিন কোনো কারণে কোনো কোশ্চেন করেছিলেন, আমাকে প্রশ্ন করেছিলেন, আমি আনসার দিতে পারিনি বা আমি একটা রং আনসার দিয়েছি। তো স্যার আমাকে খুব বকাবকি করেন কি তুমি, তোমার বাবা মা এত ভালো, এত সিম্পল, আর তুমি পড়াশোনা করতে এসছো, তুমি পড়াশোনা না করে শুধু এরকম বদমাশি করছো, খেলছো, এই করছো করছো। আমি খেলাধুলা খুব পছন্দ করি, স্পোর্টস আমি খুব পছন্দ করি। এখনো আমি ইউনিভার্সিটিতে এখানে টিচিং প্লাস নন টিচিং বোথের ইউনিভার্সিটি চ্যাম্পিয়ন ব্যাডমিন্টনের। ফুটবলও আমি খেলি, ফুটবলও আমি পছন্দ করি। তো লাস্ট 7 ইয়ার্স ধরে আমি ইউনিভার্সিটি চ্যাম্পিয়ন, স্কুল অফ লাইফ সায়েন্সের চ্যাম্পিয়ন অ্যাজ ওয়েল অ্যাজ ওভারঅল। তো আমি খেলাধুলা খুব পছন্দ করি, তখনও করতাম, এখনো করি। তো স্যার একদিন বললেন কি তুমি পড়াশোনা করছো না, এই করছো না, শুধু খেলাধুলা করছো, কি করবে আগে, যে তোমার বাবা মা এত আশা করে রেখেছে, অনেক কিছু বললেন, অনেক কিছু বকাবকি করলেন। আমি খুব, মানে সেদিনকে আমার খুব দুঃখ হয়েছিল, আমি এমন কিছু করিনি, আমি জাস্ট খেলতাম, তাই আমাকে এত বকাবকি করলেন স্যার। তারপর আমি বললাম না স্যার, আমি একদিন কিছু করে দেখাবো আপনাকে, আই মেক ইউ ফিল প্রাউড। তারপর আমি পড়াশোনা স্টার্ট করলাম। আমি টিউশন করতাম তখন, টিউশন পড়াতাম। তারপর আমি গ্র্যাজুয়েশন কমপ্লিট করলাম, 3rd র্যাঙ্ক এলো আমার। তারপর আমি পিজিতে অ্যাডমিশনের জন্য দিল্লি গেছিলাম, দিল্লিতে আমি এন্ট্রান্স দিলাম, ওখানে হলো, কিন্তু কোনো কারণে আমি দিল্লিতে অনেক ফিনান্সিয়াল প্রবলেম হয়ে গেছিল, কিছু কিছু একটু। আমি বললাম না, দিল্লিতে না পড়ে আমি বিদ্যাসাগরও পড়তে পারি। কৌশিক বোস স্যারের সঙ্গে আমি দেখা হয় যখন আমি গ্র্যাজুয়েশনে আমরা যাই, কলেজ থেকে আমরা ইউনিভার্সিটিতে যাই ভাইভা দিতে, যদি সবার মনে থাকে, আমরা ওখানে ভাইভা দিতে যাই। তো স্যার জিজ্ঞেস করলেন, স্যার অনেকগুলো প্রশ্ন করলেন, আমি অনেকগুলো আনসার দিলাম। স্যার ইজ ভেরি হ্যাপি, স্যার ওয়াজ ভেরি হ্যাপি অ্যাট দ্যাট টাইম, মানে অনেক, ওনার খুব ভালো লাগলো। স্যার নিজেই বললেন যে সুবল, গ্র্যাজুয়েশন করার পর মাস্টার্স এখান থেকে করবে, আর যদি স্কোপ পাও তাহলে আমার কাছে পিএইচডি করবে। আমরা অবভিয়াস স্যার, আপনি বলে দিয়েছেন মানে বাস, দ্যাটস অল। তারপর আমার কোথাও এটা একটা ইচ্ছা ছিল কি কোথাও না গিয়ে, আমি স্যার বলেছিলেন আমি এখানেই আসি, আমি বিদ্যাসাগরে আবার অ্যাডমিশন নিই, ওখানে পড়াশোনা করি। সব স্যাররাই, সব টিচার্সরাই আমাকে খুবই ভালোবাসতেন, আমিও স্যারদিকে অনেক রেসপেক্ট করি, এখনো করি, আগেও করতাম। আমিও খুব ভালোবাসতাম, ওনারাও আমাকে খুব ভালোবাসতো, বললো না দেখো কিছু করো। তো আমি স্টার্ট করলাম। তারপরে না, ফিজিক্যাল অ্যানথ্রোপলজি স্পেশালাইজেশন দিলাম। তারপরে আমি, যেমন আমার সিভিতে দেয়া আছে কি আমি কাউন্সিলরে জয়েন করলাম। তো এর পেছনে সব আমার স্যারদের আশীর্বাদ, আমার স্যারদের একটা মোটিভেশন ছিল, কেবল কিছু করতে হবে। গ্র্যাজুয়েশনের পর, আর গ্র্যাজুয়েশন করার সময় যে আমাদের স্যার ছিলেন কৌশিক ভট্টাচার্য স্যার, সুব্রদেব স্যার বললেন, যদি তুমি ফার্স্ট ব্যাচ, তোমাদের মধ্যে যে ফার্স্ট নেট ক্লিয়ার করবে তাকে এখানে হলদিয়া গভর্নমেন্টে জব দিয়ে দেওয়া হবে। তো একটা ড্রিম টাইপের, আচ্ছা এরকম হয় নাকি, আমরা জানতাম না তখন এত বেশি। তো ঠিক আছে, তো মাস্টার্স কমপ্লিট হলো, তারপর নেট কোয়ালিফাই করলাম 2007-এ। আমি এনজিওতে যখন কাজ করছিলাম অ্যাজ এ কাউন্সিলর, তারপর আমি স্যারকে ফোন করলাম, স্যার আমি নেট কোয়ালিফাই করে গেছি এবার। বলছি ঠিক আছে, ভেরি গুড, যখন পোস্ট বেরোবে অ্যাপ্লাই করবে, এরপরে তুমি এবারে জেআরএফ এর জন্য ট্রাই করো আর পিএইচডি করে ফেলো। ঠিক আছে, তারপর আমি প্রজেক্টে কাজ করলাম। স্যাররা আমাকে বললেন কি এখানে প্রজেক্ট এসছে, তুমি চলে এসো। আমি চলে এলাম, প্রজেক্টে জয়েন করলাম, আইসিএমআর এর প্রজেক্ট। তারপর প্রজেক্টটা 2 বছরে চললো, শেষ হলো। তারপরে আমি সোশ্যালজি ডিপার্টমেন্টে 6 মাসের জন্য প্রজেক্ট ফেল হলাম। তারপর জেআরএফ আমি পিএইচডির জন্য এনরোল হলাম। পিএইচডির পর তারপর আবার যখন পিএইচডি জাস্ট কমপ্লিট হবে, তো তারপর কি করব এবার, আই এম গোইং টু কমপ্লিট মাই পিএইচডি, এবারে কি, হোয়াট নেক্সট। তারপরে আমার একজন কলিগ ওখানে জয়েন করেছিলেন, তখন রিসেন্টলি জয়েন করেছিলেন ডক্টর সঞ্জয় মাম ইয়াইফাবা মেথি স্যার। মেথি ইজ ভেরি গুড ফ্রেন্ড অফ মি, মানে অনেক ভালো বন্ধু। মেথি স্যার জয়েন করেছিলেন তখন 2012-তে, আর সোহাঞ্জন দা জয়েন করেছিলেন, দুজনই জয়েন করেছিলেন। তো ইয়াই বললো কি ওখানে গুরু কাশীদাস সেন্ট্রাল ইউনিভার্সিটিতে পোস্ট বেরিয়েছে অ্যাডহকে, তুমি অ্যাপ্লাই করো। তো আমি অ্যাপ্লাই করলাম, আরে অত দূরে যাবো এই ওই হেনা তেনা, এত ভালো লাগছে না। বললাম, না চ না ঘুরে আসি। তো গেলাম ওখানে ওর সঙ্গে, আরো 2-4 জন গেছিলেন। এখন অনেকে নাম জানে, শুভময় কিসকু এখন ক্যালকাটা ইউনিভার্সিটিতে আছে। তারপরে আমার সঙ্গে আরেকজন গেছিল উইড্রম সুরজ সিং, ও এখন মণিপুর সেন্ট্রাল ইউনিভার্সিটিতে আছে অ্যাজ অ্যান অ্যাসিস্ট্যান্ট প্রফেসর। তো আমরা 3জনই গেছিলাম, আর সুরজ তো ইয়াই আমাদের নিয়ে গেছিল। ও এখন আবার মণিপুর সেন্ট্রাল ইউনিভার্সিটিতে জয়েন করেছে, বিদ্যাসাগর থেকে চলে গেছে। তো এই 4জন বন্ধু আমরা ছিলাম, ইন্টারভিউ দিলাম। ইন্টারভিউ পর পুরো রাত ট্রেন 12 ঘন্টা লেট, আমরা স্টেশনে বসে কি হবে কি হবে না জানি না, 4জনই বসে আছি, রোটেশন ওয়াইজ আমরা ওখানে বসছি, কেউ পড়াশোনা করছি, গল্প করছি। তারপর যখন ফিরে আসি তখন হলো কি আউট অফ 26 ইউ আর সিলেক্টেড। সিলেকশন হলো, তারপর ওখানে জয়েন করলাম। তারপর মনে হলো কি চলো জয়েন করেছি, পিএইচডি কমপ্লিট হয়ে গেছে, ভাইভা হয়ে গেছে, এবার কি করা যায়। তারপর অনেক জায়গায় ট্রাই করলাম আমি আমি সিআরআই কালচারাল রিসার্চ ইনস্টিটিউট, যেখানে মোহন, তারপরে সিরাজ, বিজিতেন্দ্রীয়, অনেকে যারা এখন নন্দীগ্রাম কলেজ, বিভিন্ন কলেজে জয়েন করেছে, তারা সবাই আমরা একসঙ্গে গেছিলাম ইন্টারভিউ দিতে। সিআরআই আমার সিলেকশন হয়নি, বললো তুমি বাংলা জানো না ভালোভাবে, ফার্স্ট ক্রাইটেরিয়া, তুমি বাংলা জানো না ভালোভাবে, তো তোমার সিলেকশন কি করাবে, তুমি ডেটা কালেকশন করতে পারবে না, সামথিং সামথিং। তারপরে অনেক জায়গায় ইন্টারভিউ দিলাম, কলেজ সার্ভিস কমিশন, পিএসসি, বারাসাত ইউনিভার্সিটি, অনেক জায়গায় দিলাম, হয়নি সিলেকশন। আমি অনেক ভেঙে পড়েছিলাম, কি হবে এরপর, আমি তো ওখানে অ্যাডহকে আছি, কতদিন থাকবো জানি না। তারপরে ওখানে আমার র্যাপও খুবই ভালো ছিল, পড়াশোনা 1 বছর আমি খুব ভালো করে, খুব হার্ড লেবার দিয়ে আমি ভালো করে পড়ালাম ওখানে। তো আমাদের যে ডিন, আমাদের যে এইচওডি, সবাই হাইলি ইমপ্রেসড। তারপর ওখানে ইন্টারভিউ হলো পার্মানেন্ট পোস্টে। তারপর আমি ইন্টারভিউ দিলাম, রেজাল্ট বেরোয়নি। আমি তখন হেড়িয়াতে ছিলাম, পূর্ব মেদিনীপুরের হেড়িয়াতে ছিলাম, ওয়াইফের কাছে। ওয়াইফ স্কুল টিচার ছিলেন ওখানে, হেড়িয়া স্কুলে ওখানে। তো ওখানে ছিলাম, তখন ডিন ফোন করলেন কি সুবল, there is one good news for you। কি স্যার বলুন। তো উনি বললেন, বলছি না চলে এসো এবারে বিলাসপুর সব সময়ের জন্য। স্যার কি হয়েছে বলুন। তোমার সিলেকশন হয়ে গেছে, এখন কাউকে বলবে না। ইট ওয়াজ লাইক ইউরেকা ফর মি। তো দিস ইজ অল অ্যাবাউট মাই জার্নি। তারপর থেকে আমি যা কাজ করেছি, যা করছি, অনলি ফর দ্য স্টুডেন্টস। সবসময় চাই কি স্টুডেন্টস আরো কোথাও যাক। আমার 2জন স্টুডেন্ট লাস্ট ইয়ার হরিশঙ্কর গড় সাগর ইউনিভার্সিটিতে পিএইচডির জন্য এনরোল হলো, ওখানে টপ লিস্টে ছিল ওরা, দুজনে নেট কোয়ালিফাই করেছে, এখন ওরা পিএইচডির জন্য ওখানে এনরোল করেছে। লাস্ট আমার কাছে 2জন যারা কাজ করছে, 2জনই নেট, একজন জেআরএফ, একজন এলএস, একজন জব করছে আর একজন এসআরএফ এ আছে। দিস ইয়ার একজন নিনে জয়েন করলো অ্যাজ এ ফিল্ড ইনভেস্টিগেটর, একজন এখন কাজ করছে, ওর পাবলিকেশন লাস্ট পরশু আমাদের একটা নতুন পাবলিকেশন এসছে। তো হার্ড লেবার ইজ ভেরি ইম্পর্টেন্ট। এইগুলো আমি কেন বললাম, কিন্তু এই যে জার্নিটা, এই জার্নিতে অনেক কষ্ট হয়েছে আমার, কিন্তু আমি ভেঙে পড়িনি। আমার স্যাররা আমাদের সঙ্গে ছিলেন, গ্রাজুয়েশনের স্যাররা, মাস্টার ডিগ্রির স্যাররা এখনো আছেন। এখনো আমরা কথা বললে আমাদের খুব ভালো লাগে, খুবই ভালো লাগে। আমরা মেলের কন্ট্যাক্টে আছি, আমরা ফোনে কন্ট্যাক্টে আছি, কথা বলি। তো দে আর ইন্সপিরেশন ফর আস। আর হার্ড লেবারের আগে কিছু নেই, আমাদেরকে খুব কষ্ট করতে হবে, হার্ড লেবার করতে হবে, দেন অনলি উই ক্যান রিচ আওয়ার গোল, উই ক্যান অ্যাচিভ আওয়ার গোল। তো তাই এটা আমার রিকোয়েস্ট, আমার সবাইকে এটাই আমার রিকোয়েস্ট কি সবাই খুব ভালো করে যেটা পড়বে, যেটা করবে, সেটা খুব ভালো করে করতে হবে। ইউ উইল ডেফিনেটলি রিচ, will definitely get your goal। এটাই আমার বলার সবাইকে, কি খুব মন দিয়ে ভালো করে পড়াশোনা করো, খুব ভালো করে রিসার্চ করো, যে কাজটা করবে এটা খুব ভালো করে করো। খেলাধুলা মিন্স খেলাধুলা, পড়াশোনা মিন্স পড়াশোনা, রিসার্চ মিন্স রিসার্চ। অ্যাডমিনিস্ট্রেটিভ জব আমি এই যে কিছু আমাকে 9খানা ভিলেজ আমরা অ্যাডপ্ট করেছি এখানে ছত্তিশগড়ে। পুরো ইউনিভার্সিটি আমরা ভিলেজ অ্যাডপ্ট করেছি তাদের ডেভেলপমেন্টের জন্য, MHRD প্রোগ্রাম। পুরো ইউনিভার্সিটিতে 5 জন মেম্বার, তার মধ্যে একজন আমি। তারপরে CDC কমিউনিটি ডেভেলপমেন্ট সেল আরো কমন ভিলেজেস অ্যাডপ্ট করেছি, ওখানে আমি মেম্বার। তারপরে HRDC হিউম্যান রিসোর্স ডেভেলপমেন্ট সেন্টার, যেখানে টিচার্সদের ট্রেনিং দেওয়া হয় ফর দেয়ার প্রমোশন অ্যান্ড অল, ওখানে আমি অ্যাসিস্ট্যান্ট ডাইরেক্টর ছিলাম। ওখানে আমি রিজাইন করলাম কি না, আমার উপরে অনেকগুলো প্রেশার পড়ে যাচ্ছে, কারণ ডিপার্টমেন্ট আমাদের ছোট এখনো ফ্যাকাল্টিজ এখন 3 জনই পার্মানেন্ট ফ্যাকাল্টি, অ্যাডহক ফ্যাকাল্টি 5 জন। তো অনেকগুলো প্রেশার থাকে, অনেকগুলো কাজ থাকে, ইউজি, পিজি, পিএইচডি, এতগুলো ব্যাচ, এতগুলো স্টুডেন্টস, তো প্রেশার অনেক বেশি। তাই আমি রিজাইন করলাম। ওখানে ভাইস চ্যান্সেলর ম্যাডাম নিজেই বললেন, সুবল কেন ছাড়ছো, কোনো প্রবলেম? আমি বললাম, না ম্যাম প্রবলেম নেই, কিন্তু আমি আই ক্যানট জাস্টিফাই মাই সেলফ, I cannot give my 100% there in my department as well as in HRDC, আমি দিতে পারছি না দুই জায়গায় সাইমালটেনিয়াসলি, তাই আমাকে প্লিজ রিলিভ করে দিন। তো ম্যাডাম অনেক দুঃখ প্রকাশ করলেন, না তুমি থাকলে ভালো হতো, যেখানেই থাকো যেন, যেখানেই থাকো যে যে ওখানে বস থাকবে, বা বস নয়, যে কালিগ থাকবে বা সিনিয়র থাকবে, তার সঙ্গে এমন ভালোভাবে কাজ করে ওকে দেখিয়ে দিতে হবে কি না, ইউ আর সামওয়ান, ইউ আর সামথিং। তো এই জিনিসটা অবশ্যই বানিয়ে রাখতে হবে সবাইকে, আর ভালোভাবে কাজ করতে হবে, মন দিয়ে কাজ করতে হবে, এটাই আমার সবাইকে রিকোয়েস্ট। ঠিক আছে, থ্যাংক ইউ।
ওকে স্যার, ওকে স্যার। এবং স্টুডেন্টের জন্য আর দুটো কথা বলি। স্যার বর্তমান যে পজিশনে আছেন এবং তার পূর্বে অ্যাডহক টিচার হিসেবে ছিলেন গুরু ঘাসি দাসে, এবং এই আমাদের কলেজেরই আরো দুজন স্টুডেন্ট, অনিন্দিতা, ডক্টর অনিন্দিতা নায়েক এবং শুভেন্দু পাত্র,
দুজনকে এনেছি এখানে,
আমাদের কলেজের স্টুডেন্ট। অনিন্দিতা নায়েক সি জাস্ট দা ব্যাচ অফ সুবলদার পরের ব্যাচ,
আমাদের পরের ব্যাচ।
ইয়েস, অনিন্দিতা। এরাও কিন্তু গুরু ঘাসি দাসের অ্যাডহক টিচার হিসেবে কিন্তু দুজন আছেন। সো আমাদের কলেজ
লাস্ট ইয়ারে জয়েন করেছে অনিন্দিতা, এই বছর জয়েন করেছে রাঁচির থেকে। শুভেন্দুর 2 বছর হয়ে গেল এখানে জয়েন করা।
ওকে ওকে, শুভেন্দু 2 বছর হয়ে গেছে। সো এটাও কিন্তু কম ইন্সপিরেশনাল নয়। এবং শুধু তা নয়, এর বাইরে আরো রয়েছে শুভেন্দু, শুভময় কিস্কু, তমাল পাঠক, অমৃতা মুখার্জি, মৌমিতা মাইতিদির কথাটা আমি জানি না, প্রিয়াঙ্কা দি, অনেকেই আছেন যারা বিভিন্ন জায়গায় বিভিন্ন ক্ষেত্রে তারা এমপ্লয়েড, আমাদের ডিপার্টমেন্টের স্টুডেন্টরা। মানে আমি এটা বলতে পারি, যেহেতু আমিও বিদ্যাসাগর ইউনিভার্সিটির কোনো একটা কলেজের ছাত্র ছিলাম, আর বিদ্যাসাগর ইউনিভার্সিটির কোনো একটা কলেজে, যে কলেজটা থেকে সুবলদা পাস করেছে, সেখানেই আমি এখন রয়েছি। সো বিদ্যাসাগর ইউনিভার্সিটির মধ্যে আমার মনে হয় হলদিয়া সরকারি মহাবিদ্যালয়ের নৃতত্ত্ব বিভাগের ছাত্রছাত্রীরা বোধহয় বিভিন্ন ক্ষেত্রে তারা মনে হয় বেশি করে এমপ্লয়েড, এটা আমার ধারণা। ওকে স্যার, আপনাকে অসংখ্য ধন্যবাদ। একটা নাইস ইভিনিং আমরা আপনার সঙ্গে কাটালাম, এবং আমরা এই কারণে আরো ধন্যবাদ জানাচ্ছি আপনার যে এই ব্যস্ত একটা শিডিউল, এই ব্যস্ত শিডিউলের মধ্যে আমাদের জন্য একটু সময় বের করেছেন, আমাদের ছাত্রছাত্রীদের জন্য সময় ব্যয় করেছেন। আমরা আপনার প্রতি কৃতজ্ঞ, এবং আমরা লাকিও বলতে পারি যে আপনাকে আমরা পেয়েছি, আমাদের ছাত্রছাত্রীরা আপনাকে পেয়েছে, এবং আপনার টকের দ্বারা তারা নিশ্চয়ই একাডেমিক বেনিফিট যেমন পেলো, তারা তাদের নিজেদের মধ্যে একটা এনকারেজমেন্টও আনতে পেরেছে বলে আমাদের ধারণা। সো অর্গানাইজিং কমিটির পক্ষ থেকে আপনাকে কিন্তু অসংখ্য অসংখ্য ধন্যবাদ জানাই স্যার। থ্যাংক ইউ স্যার। Good night, sir.
Thank you to all.
Okay, good night to all the participants, and bye.
Bye. Thank you.
Okay, sir. Thank you.
Thank you.
Govanda, thank you.
Thank you.